Hello everyone. This is Dr. Mike Chu, a physical therapist. Hey, today, I had a person come in. They walked in our clinic. I'm here in our Union City location. I've been seeing patients here, and we've been getting busy. Thank you. Shout out to Union City location. And then there's a patient who walked in. It was a son, and then he asked, "Hey, what can you do for my mother? She's 80 something years old, and she's been falling." And out of nowhere, we just talked about the situation and everything. So there are several causes of falling. There's two types, right? Again, if you're watching live, comment live. Watching on a replay, comment replay. And before I keep on going, check out medbridgeeducation.com. MedBridge Education is a CEU, continuing education units. If you're a physical therapist and or occupational therapist, you need continuing education units. Check them out. Check out MedBridge. Use our code alternative, and you get like 40% discount. Okay, and of course, Hello Note. Check out Hello Note. They have been very good. We use them in our documentation system, and then we use them for our private practice. But let's go back to the question that the person came in here, walked in. The person himself is the son, and then she was like wondering, hey, how could you help my mom? She's always falling. I explained to him that there are several causes of falling. There are two factors. So first is obviously the external factors, right? You got pets at home, you got like a throw rug there, and those are very controllable factors. But what we're going to be talking about are the internal factors, right? The internal causes of falling. So first is the muscles, the muscle weakness. That's an actual diagnosis that we put in our EMR or submitting to the insurance. Muscle weakness. If the muscles are weak, as you get older, you get muscle atrophy, and the muscles are weak, are not able to fire well. If your quads, the front part of your leg, or your glutes, the muscles that help you stand up and control you and balance you, that is, if it's weak, you're going to have a hard time. You're going to start falling, right? So you need muscle tone and muscle strength, okay? So it's very important that you do your exercise, physical therapy, right? So the next cause is your blood pressure. When you go to the doctor, or when you go to a physical therapist, right? They need to check your blood pressure laying down, sitting, and standing. If it changes, we call it orthostatic hypotension. If it changes more than 20 points or 20 millimeter mercury, and if their blood pressure goes down, then the person or the patient can get dizzy. Imagine if they're standing up, right? They're standing up, especially for those, the postural orthostatic syndrome. People who just stand up, blood pressure goes down, the POT syndrome. They would just imagine they're standing up and walking, and then their blood pressure keeps on going down. Then they can get dizzy. Me, I'm like, I'm just almost 50. I'm just squatting down, the squatting position. Maybe I'm tying my patient's shoe, helping them out, putting on their shoe on, and then I stand up quickly. I get dizzy. And that's the change in your blood pressure. The blood pressure from your head, blood pressure from your heart, they go down, then you can get this. So it's very important that you have your blood pressure check, laying, sitting, and standing, and that way you can see a difference. If there's a big difference, you gotta talk to your doctor, okay, or your therapist. Next is your eyes, your eyes or your vision. When you go to a doctor's office, they need to check in. They flash a light, just like something like this. They flash this light on you. Well, is it working? Yeah, there you go. They flash a light on you. If your pupils, that's right, so your pupils doesn't constrict as quickly as possible, the light could come in. Then you can get if it's not reacting as quickly as possible, then you can get dizzy, right? And then of course your vision, right? When you're transitioning from a dark room to a bright room to a bright room to a dark room, and here we try to make it, really bright, in that way it's all consistent. But imagine, well, we watched Spider-Man last week, and it was in a dark movie house, and then we went out, it was still bright. I suddenly got dizzy. So what more for our elderly clients? So you have to make sure that your eyes check, right? Go to your eye doctor, or your medical doctor, have them check, right? Next is your inner ear. Your ear has crystals, just let's just say this is your canal. You got, shout out to Yeti, right? So let's just say this is your ears, right? And you got crystals inside here. When you lean forward, those crystals moves forward. Normally, it kind of balances it out like what I'm doing right now. I'm sitting down on my chair. The crystals goes back in. But if those crystals are out, then you start getting dizzy. That's called your vertigo. And when we do that, we check, we kind of put those crystals back in. It's called the Epley maneuver or Dix-Halpine maneuver. We kind of we kind of move that crystals back in, and we can see the eyes moving. And we call that nystagmus, right? Nystagmus. So you gotta have your eyes and your ears checked, right? Next thing that they need to check is obviously or causes their reflexes or your reaction time. They need to check your reflexes, get a neuro hammer, checking that elbow reflexes, your lower extremity, your knee reflexes. Why? Because you have what you call your quick muscle movement. When a person is about to fall, they need to use those quick muscle movement. If they don't have that, guess what? They're going to start falling. They won't be able to catch themselves, right? So it's very important that you work on that too. You go to your therapist or go to your doctor, ask them, hey, how can I improve my reflexes? And it's like, oh, I've always been like this. No, that's why it's called rehab. Re means repeat. Have means habilitate. The more you repeat something, the more the body rehabilitates, right? Habilitate means life. So the more you do it, that's why it's called reflexes. You got to keep doing it again and again. That's why they call it training, right? Next causes of falling is your sensation or your proprioception. Sensation, if you have neuropathy, right? Neuropathy, neuro means nerve, pathy means pathology. If you have nerve problems, your sensation in your foot decreases. Guess what? Your proprioception also decreases. Your proprioception is knowing where your joints or your arm or leg is in place. So let's just say I close my eyes, right? And I know deep inside when I close my eyes, I know my hands are down, I know my hands is up, I know it's on the side, I know my thumb is up, or something like that. Same thing with your legs. That's called your proprioception. Well, imagine if you're in a dark room and you're stepping on something and then you don't have a proprioception, you're stepping on an uneven surface, guess what? You're going to start falling, right? So that needs to be addressed too, right? And then number 7, it's your medications and your medical condition. Medication can cause some dizziness, some medication can cause some more falling. So it's very important that you have a good, a physician, a PCP to manage your medication because yes, medications are good, but there's also side effects on it. So you got to weigh those between the two. Do you want the effect of this medication or the dizziness and falling? Maybe your doctor, your physician can adjust it. Your nurse practitioner can adjust it slowly and titrate it, very small doses, and you start going up. All right, and of course your medical condition. You could have a stroke, right? You could have Parkinson's. You could have MS or multiple sclerosis. You can have OA or osteoarthritis or rheumatoid arthritis that is affecting your movement and your balance. Now, here's the thing, that person came in asking what they can do for their mom, and I told them about this, the causes. And of course, just like me, I want a solution to those problems. So once you've diagnosed, once you figure it out, what's the cause, obviously go to a physical therapist, and have them do a thorough assessment on your loved ones. Have them check their muscle strength, have them check their blood pressure, have them check their eyes, and have them check their ears, have them check their reflexes, their sensation, of course, the medication. Most of the time, when you go to a therapist, they'll just check one thing, the muscle, right? Or if you go to an eye doctor, they just check your eyes, right? Or to go to the ear doctor, just check your ears, right? So when you go to a good physical therapist, they need to check everything. Your lung sounds, your blood pressure, your bowel movement. It's if you're constipated, you're taking all this pain medication, right? A side effect, if you're constipated, it's going to affect you too, right? So it's very important that you go to a good therapist, a good physician, good nurse practitioner, and we have a lot of nurse practitioners and physicians that we collaborate with. So it's very important there. Okay. So again, just remember those causes, and the solution to it obviously is not more medication, but more exercising, more therapy. All right. So there's a time and place for medication. It's very important too. I take blood pressure pills, I take my cholesterol pills, and my diabetes medication. But it's also important for me to exercise, and that's what I want you to do. That's what all I preach to our patients here. That it's very important that you move. You move. Lotion. Motion is lotion to your joints. Again, thank you very much. I appreciate you. Be awesome, be great, be excellent. But before I let you go, always remember the word fast, FAST, the letter F. Find people that will bring out the best in you, because you are the average of the 5 people you hang out with. So today, I hang out with you. I know you're awesome if you're watching live. So make sure you find people. Okay. Next letter is letter A. Take action. All this stuff that I'm doing, these videos and everything, it's not going to do me good. It's not going to do all the people that I interview if you don't take action. All right, take action by doing your therapy, going to exercise, going to the gym, going to your doctor. Go to your PCP and have a checkup. Okay. Next letter is letter S. Share and subscribe. The more shares, the better. And last but not the least is letter T. Is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. So teach it. Share this video. Hey, my mom is swallowing. Let me watch this real quick. All right. Be awesome, be great, be excellent, and we'll see you in the next episode of our Rehab show. Bye-bye.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care.